The profession of nursing, as we know it today, has evolved greatly thanks to the contributions of key figures and major historical events. In ancient civilizations like Egypt, Greece, and Rome, nursing was often a family responsibility. Women in households were expected to care for sick relatives. In some cases, priests or religious figures were also involved in healing. The Greeks believed in the connection between health and cleanliness, and many of their healing practices influenced modern medicine. However, there were no formal schools or training programs for nurses. During the Middle Ages, the Christian Church played a big role in the development of nursing. Religious orders, such as nuns, often took on the responsibility of caring for the sick. Monasteries and convents built hospitals, and religious women served as nurses. They provided basic care, comfort, and compassion to patients, many of whom were victims of diseases like the plague. Though the knowledge of medicine was limited, these early nurses were committed to helping those in need. The 19th century marked a significant turning point in the history of nursing. The most well-known figure from this period is Florence Nightingale, often referred to as the founder of modern nursing. Born in 1820 in England, Nightingale came from a wealthy family but chose to become a nurse, which was considered a low-status profession at the time. Nightingale became famous during the Crimean War when she organized and improved the sanitation of British military hospitals. Her efforts drastically reduced the death rate among wounded soldiers. She emphasized the importance of cleanliness, proper nutrition, and fresh air, which were revolutionary ideas at the time. After the war, she established the Nightingale School of Nursing in London in 1860. Her methods and principles formed the foundation for nursing education and practice. She also wrote many books on nursing, which helped elevate the profession and attract more women to the field. In the 20th century, nursing continued to evolve as more training programs were created and nurses gained greater responsibilities. During World War I and World War II, nurses played crucial roles in caring for wounded soldiers. Their work on the battlefield and in military hospitals earned them recognition and respect worldwide. In the post-war era, nursing expanded into specialized areas such as surgery, pediatrics, and mental health. Nurses were no longer seen as mere assistants to doctors, they were viewed as professionals with essential skills and knowledge. The establishment of professional organizations, like the American Nurses Association, helped advocate for better working conditions and higher standards of education for nurses. Today, nursing is one of the most respected and vital professions in the healthcare industry. Nurses work in hospitals, clinics, schools, and even in patients' homes. They provide not only physical care, but also emotional support. Advanced education has allowed nurses to take on more specialized roles, such as nurse practitioners, nurse anesthetists, and nurse educators. The COVID-19 pandemic highlighted the essential role nurses play in modern healthcare systems. They were on the front lines, caring for patients and providing critical support during the crisis. This global health emergency underscored the need for more nurses and better healthcare infrastructure around the world. The history of nursing is one of dedication, compassion, and progress. From ancient caregivers to modern-day professionals, nurses have always been at the heart of healthcare. The profession has evolved from humble beginnings to become a highly respected field, with countless contributions to improving the health and well-being of people around the world.